Welcome to another episode of MedTalk. We have a special guest, Dr. Pooja Shah, with us today to discuss current status of the pandemic as well as updates on vaccine. Dr. Shah is an infectious disease physician currently in private practice in Edison, New Jersey. Dr. Shah, welcome again to MedTalk.
Thank you so much, Dr. Patel, for having me again.
So you came to MedTalk twice before and provided some useful information to our viewers. We are into 9 months with this pandemic now, and as of today, more than 18 million people infected with the virus, and close to 325,000 died in this country only. And the situation is very grim in the USA. Can you describe the current status of pandemic and where are we heading with this pandemic? How about in the hospitals where you work? How are the things there? Is it like what we had back in March and April?
So currently, we are in our second wave of our COVID-19 pandemic. The cases are rising every day. The numbers are even higher than what it was back in March and April with the positive number of people with COVID-19. Currently, the hospitals are starting to get overwhelming. More cases are coming in every day. This time around, though, majority of the patients are not as sick as they were the first time around, but we do have very sick patients, and we still have a spectrum from mild cases to very severe cases. We are currently doing everything we can for our patients, but I still think it's very, very important for everybody to wear masks, social distance, and hand washing, and try to avoid large gatherings.
So how about the resources in the hospital setting right now? Is it still problem like before, or you have enough PPEs, ventilators, and other resources you need for the medical providers, frontline workers to use?
So currently we have enough PPEs. It's still early to say where we're heading, but there has been an uptick in the number of COVID admissions this month. So I guess in the next couple weeks to a month, we'll know where we stand. It is slowly changing every day, where we're seeing number of patients coming to the hospital with more and more symptoms. We still have medications. They have approved the remdesivir by the FDA. We've been using Decadron, and based on the cases, we will use plasma. So we have some options right now, but I still tell everybody this COVID-19, there's still a lot of unknown with this disease and what really works and what doesn't work.
So we have a lot of unknowns, but we are much better prepared than before because we learned from the past experience. Is that correct?
Correct. But there's still chances that with all the therapy, it might still not work. And we're still not sure why certain patients do very well and other patients don't.
Yeah, so that's the mystery still needs to be understood and resolved. Probably the time will tell. So we know in the USA there are 4 companies have completed the clinical trials. Successful clinical trials and FDA approval are the key to roll out the vaccines. Can you describe which vaccines have been authorized for the emergency use in the USA?
So as we know, the FDA authorized emergency use access to the Pfizer vaccine and the Moderna vaccine, which both are mRNA vaccines. And each of these vaccines requires 2 doses. The Pfizer is 21 days apart, while the Moderna is 28 days apart.
And how does the Pfizer and Moderna mRNA vaccine works normally? Is it different than the older vaccines from before, or is this something new technology or new advancement in vaccine development?
So currently, both the Pfizer and Moderna vaccines are considered mRNA vaccines. Now, these are the first mRNA vaccines to be made. They've been studied and researched for about 10 years, but these are the first 2 vaccines to give us mRNA. So what does the mRNA vaccine do? It has the genetic information of the SARS-CoV-2 spike protein. This spike protein is part of the virus. And what it needs to do once you get the vaccine, this spike protein will get attached to our human cells, but it will not cause COVID-19 disease. Once the spike protein is created, it causes the immune system to cause create antibodies against the virus. Once these antibodies are made, this will protect you against the virus. And the good thing is, remember that the mRNA does not enter a human DNA cell, and they rapidly degrade. So it should not cause long-term effects down the line.
So that's the very good news about the vaccine, that it's not only safe, but it also does not give live virus into someone. Is that correct?
Correct. It is considered a dead virus.
Dead virus. Okay. So that's the wonderful news. So many of our viewers and people in the USA are still skeptical after a few weeks the vaccine is out and reluctant to take the vaccine and believe that the vaccine is not safe, as it was approved in less than a year time, and they may not have enough data on safety. What can you tell our viewers about that, and what are some of the side effects of the vaccine one can expect?
So this vaccine, the side effects are like any other vaccine that you can get. You can get side effects, such as like injection site reactions, fatigue, headache, fever, chills, joint pain, fevers. Some people can get it after the first vaccine, but when people have gotten the second dose, they've seen more of the side effects then. But these are all any vaccine you can get these side effects. And I know everybody's still nervous about it. I will say I got the vaccine this week. I didn't experience any side effects, but we will know more after I get my second dose to really say. But I have to say, most of my friends who are taking the vaccine, they have not had any issues.
Oh, that's a wonderful news. So how about the efficacy or effectiveness of this vaccine? What do you tell our viewers about the
So
vaccine?
based on the clinical trials, they said the Pfizer vaccine is 95% efficacy rate after the second dose, and the Moderna is about 94%. And it's consistent across all gender, age, race, and ethnicity.
So why there are two doses of the vaccine? If someone takes only one dose, how does that work out?
I guess based on their clinical trials, the first dose maybe give about 50% protection. That's why they're doing the second dose to give you a higher protection rate. So that's why it's recommended to take 2 doses.
So once someone receives the vaccine, is he or she back to normal life and free to do everything like they used to do pre-pandemic, or do we still need to take some steps after taking the vaccine?
So right now, we still have to wear our mask after the vaccine. So there's a limited supply. We still have to vaccinate our public. Right now, they're giving the vaccines to healthcare workers and residents in long care facilities like nursing homes and LTACs. So once everybody has the ability to be vaccinated and we create some immunity against the virus, I still recommend that you should still wear a mask. We actually still don't know how long the immunity is going to last still. So it's just better for now. Everyone still take all the precautions despite getting the vaccine.
So let's talk further about the vaccine. Is the vaccine safe in all categories, like in pregnant females, kids, people with immunocompromised status?
So as of now, the clinical trials have showed it more for people above a certain age, but those who are like pregnant, they're lactating, immunocompromised patients and pregnant patients, we're just saying right now to talk to your healthcare provider to see what the guidelines are based on the society. If you're not sure, the best thing is to talk to the healthcare provider.
So you don't recommend those categories blindly take the vaccine without consulting with their physician. Is that the message you want to give?
Yes, I agree. It's better, even if you're healthy and you're not sure, I think it's best to talk to a healthcare provider if you're unsure. If you have certain allergies or you get severe allergies, I would also recommend you speaking to your healthcare provider. You'll hear in the news that somebody got an allergic reaction to the vaccine, but you have to remember it's one person out of many people. So that's why they're recommending, if you have any uncertainty, talk to your healthcare provider first, who knows your history, your background, everything.
So let's talk about some challenges. So we know that the vaccine rollout and distribution is at a slower pace than we expected in this country. And as of yesterday, what I read, we only had 4.6 million doses shipped in the USA, and only 600,000 600,000 people received the vaccine. Do you think we will have enough vaccines for everyone by summer next year?
I think so. We now have two companies right now. So I think with the two companies combined, eventually we'll have enough vaccines for everybody, but it's just going to take some time.
Great. So let's talk about something recently developed in the last 48 hours, that the new strain, which is mutated variant of COVID-19 found in the UK and some other European countries. What can you tell our viewers? What precautions should we take in the USA? And is the current vaccine give any protection against the infection from this new strain?
So for the vaccine, to know if it gave any protection against the new strain, it's too early to say. We just found out about this new strain, so there's going to be a lot of research and data coming out in the next month or so. So I think right now it's hard to say if it's going to provide any protection or not. But like I said, we still have to do what we've been doing: wear a mask, social distance, hand washing. And the main thing, I know with the holidays around, we all want to have gatherings with our loved ones and family and friends. But right now, I think it's best you just try to avoid all those events, because this new strain or whatever COVID-19 is out there, you have to realize it's a contagious virus still. And we're still learning about the new strain. We're still learning about new things about it. So as of now, I would still practice what we've been saying since March.
Good advice. Good advice. So as a medical expert, what do you think? Should we consider restricting travel from the European countries, especially England? Do you think that will be a good option?
As of now, I think we should restrict all travel. This virus is still out there. It's still rampant. It's going around the world. I would recommend that you shouldn't travel right now. Until we have the virus contained, we have better data, better information, it's best to just be safe and take all your precautionaries.
So as a medical expert, how do you see the future in upcoming months with this pandemic, and how long will it be before we see some changes and some normalcy in 2021?
I'm hoping now with the vaccine out, we'll have more immunity. That's the whole point of the vaccine, to provide immunity to our public, to help stop the spread of this virus. It might not be till next summer, but at least there's some hope with the vaccine that it's going to give us a better future, and then maybe things will start to get back to normal next year. But right now it's too early to say which way we're going to go. But I would say we have to be patient, and there's hope in the future.
So one other question regarding the vaccine. So the vaccination is in different phases. Right now, the healthcare workers, long-term care facilities. The next phase would be the people over 75 and older, and certain frontline essential workers, and then 65 to 74, and then other high-risk medical conditions. Do you see some changes coming when the healthcare workers and the long-term care residents receive the vaccine, phase 1 completed? Will you see some changes coming, that people we will see some difference in case drop down?
I think so. It'll take some time, and especially now we're in our second wave. I think with the vaccine, we'll see a lot of changes, at least in the next couple of months. There'll be maybe a drastic change in the number of admissions we have with COVID patients.
So the key is get the vaccine as soon as you are able to get the vaccine. Is that the message you want to give?
Yes.
Good. Lastly, what is your take-home message for our viewers, specifically on the vaccine front, and what step do they need to take to protect themselves until we reach that 70-80% people in the USA, to ensure that we develop the herd immunity? Especially this week is the Christmas week, and I see a lot of people are traveling, getting together with their family, indoor gatherings. Those are not safe things. What is your message for our viewers?
Please. Safety and health is very important for everybody. Wear your mask, social distance, and hand washing. I will say it again, avoid big gatherings. Try not to have any gatherings this year if you can, because it's very easy to spread the disease. Even if you got tested and you were negative, it might be a false negative test. And you have to realize you can still pass the disease to somebody else with a false negative test. So I think at this point we need to be more alert, be more caution, and just realize that the holidays this year is not going to be seen like any other holidays. And until we reach our immunity, the virus is contained, then we can go back to what we need to do to live our regular lives.
So avoid travel, avoid indoor gatherings. If you are out in the public, wear the facial coverings, wash your hands frequently. Those are the same messages we have been giving it to our viewers since we started this back in March. So Thank you so much, Dr. Pooja Shah, for your time and expertise. I appreciate you coming back again from your busy schedule. I wish you all the best in serving your patients and staying healthy as well. Have a happy holidays, Merry Christmas, and a wonderful New Year to you and your family.
Thank you so much, Dr. Patel, for having me. I agree. Happy holidays, everybody. Happy New Year. Please be safe. Take all the caution. Trust me, we've seen the worst of what COVID-19 has done to our patients. I'd rather everybody be safe and at home with their loved ones, and try to be safe, wear your masks, and social distance and hand wash.
Thank you so much for that wonderful message. Thank you.
Thank you.